Are you tired of not being able to exercise, run, and jump because you leak urine? Are you ready to stop spending your money on panty liners, bulky pads, and bladder support products? Most importantly, are you ready to feel dry and confident on a daily basis? Then LadyLase is the answer for you. I'm Nicole Stapp, Women's Health Nurse Practitioner at Allure Medical. I want to talk to you about stress urinary incontinence and our LadyLase procedure. Stress urinary incontinence, or SUI, is more common than you think. Roughly 40% of women suffer from some sort of urinary incontinence, and stress urinary incontinence is the most common. So what is SUI? This is the involuntary leaking of urine from the bladder. This leaking takes place when stress is placed on the bladder. Stresses such as running, jumping, coughing, sneezing, and even exercising. There are many factors that increase your risk for developing stress urinary incontinence. Some of these include pregnancy, vaginal delivery, and menopause. So before you buy your next box of panty liners or consider surgery, consider LadyLase. This new revolutionary technology is the first development that can rejuvenate your vaginal tissues back to a healthier, younger state, reducing leaking as well as vaginal dryness and vaginal atrophy. LadyLase is a unique laser therapy that uses energy to heat the tissue of the vaginal canal, resulting in collagen growth and tissue tightening, allowing for more support to the bladder. After the procedure, you may experience swelling and redness, which is to be expected. But in as little as 30 minutes, you can do this procedure and resume your normal activities. So if you're ready to stay dry and comfortable throughout your day, then schedule a consultation with the provider at Allure Medical today.